Welcome, everyone, to the COVID-19 Vaccine Town Hall. This is a partnership with MDHA and Neighborhood Health and the Nashville Promise Zone Infrastructure Workgroup. So we'll talk more about that in a little bit here. But before we get started, I just want to tell you a little bit about the Civic Design Center and the work that we do and why we're involved here. So the Civic Design Center got started in the 1990s. The Nashville looked much different at the time. It was kind of before the honky tonk mecca that we know today is. But part of what started the Civic Design Center and the impetus for our development was centered around this group called the Urban Design Forum. So this was a group of citizens and activists and architects and planners, design community who met regularly to discuss civic issues in our city. And during this time, the Urban Design Forum was discussing this project that was being put forth by the state to build a interstate style highway through the area known as Sobro nowadays. But this group kind of saw that as a way that was going to really block and hinder development south of downtown. So they spoke up and met with leaders, elected officials, and made a point to say that this idea wasn't going to be good for the development in our city. And so this group was successful in basically lobbying to stop this development and created what we know as Korean Veterans Boulevard, now more human-centric, friendly style development that instead of this big elevated highway-style infrastructure. So the group had a great win with that kind of advocacy and decided that they need to form a center that could really continue to advocate for these types of issues. So that Urban Design Forum group ended up formalizing in the Civic Design Center, and then they started with the creation of the document entitled "The Plan of Nashville." So that was then they kind of got to work, started planning for the whole city, and created a document that was kind of based around the plan of Chicago that looked to create a visionary, big picture vision for the entire city. So that's kind of our origin and our roots. But our mission is to advocate for civic design visions and actionable change in communities to improve quality of life for all. So we've done that. We're coming up on our 20th anniversary of our organization, and we've had huge success and impacts over those years. And here are some of the kind of the high points of our the last 20 years of our organization. We have these 4 focus areas: education and advocacy, shaping healthy communities, mobility and land use, and reclaiming public space. And so what we're going to focus on is definitely falls into the shaping healthy communities section of our work. And it's really about how the built environment influences health in a big way. And so that is why we are a member of the infrastructure work group as part of the Promise Zone. And our kind of goal, along with Conexion America, is also a sub leader or a captain of our group. And we meet regularly to discuss transportation awareness and infrastructure related projects and how we can work to help people that live in the Promise Zone area. And so, COVID has had a big impact on infrastructure over the last year or more, especially as it relates to transportation. I mean, masks are still mandated on buses, and we're still encouraging social distancing in public spaces and open spaces. And we've realized the importance of public transportation as people have, essential workers had still been using, or people that needed to get where they needed to go were still using public transportation, even in the height of the lockdown. And so that just points to the value and importance of things like parks and open space, public transportation, and people's ability to feel comfortable in these spaces. So um, today we have two great panelists who I will let them introduce themselves, but they're kind of experts in the field as it relates to what we're talking about. And we'll also hear from Brian Hell at Neighborhood Health, and he was unable to attend, but he sent a video that has some really strong information and good, solid, fact-based information that we'll hear from in a second. But Paige, do you want to introduce yourself first?
Sure. Thank you for having me today. My name is Paige Hopkins. I'm the COVID-19 Resource Navigator with MDHA. My position I started at the agency in October, and this position came out of the need for someone to oversee COVID-related resources across all of our properties. So in the fall, I was working a lot on food security, kind of managing some of those issues, and then really since the beginning of this year, which is crazy that this has been 7 months that we've been really deep into the vaccine outreach work, started working on the logistics of making sure that we're making the vaccine readily available to our residents across all our properties, especially in the beginning, as you know, there was confusion about who was eligible and where they could get the vaccine. So really working with our social services coordinators to make sure that our residents are getting those services. So still working on that this summer, and I'll save all that for later. I'll go ahead and let John introduce himself.
Good afternoon. I'm John Walker. I'm the social service coordinator here in Nashville with Metro Development Housing Agency. I coordinate resources for properties, approximately 750 people. I have been in this position for nearly 20 years now. And I think what was important that as Paige came on as the navigator, the way I was best able to work with her was that I have the experience in the relationship with the residents. So it was important that after we were able to schedule the vaccines, that there needed to be someone on site to give them the trust and have to be able to explain the process and just what the vaccine would do for them. So, I was able to work with the residents as well as the process with Paige to get this project done.
Excellent. Thanks. Thank you both. So yeah, we'll hear more from them in a little bit, but I want to play this video that Neighborhood Health sent us for this event. So 1 second here.
Thank you for joining the discussion today about COVID-19 vaccination here in Nashville, about how to get you and Nashville and Middle Tennessee protected in this pandemic. I want to just ground what we're doing in the mission of Neighborhood Health to explain why Neighborhood Health is responding how we are to the current pandemic. We are dedicated to make sure that everyone in Nashville and Middle And the mission of Neighborhood Health to explain why Neighborhood Health is responding how we are to the current pandemic. We are dedicated to make sure that everyone in Nashville and Middle Tennessee can get a healthcare home, really get the care that they need, and have no barriers to getting that care, whether they be financial, transportation, or otherwise. That's what makes us the largest safety net provider of primary care in our region, and the largest for African Americans and more generally for persons of color. What is the goal as we respond to the pandemic and as we think about vaccination? Clearly, we want to get back to our lives, our routines, and get as much of our normalcy back as possible. But that requires herd immunity. Where are we now? Well, it's a little bit depressing. In Tennessee, according to statewide figures updated just today, less than 40% of individuals across Tennessee are vaccinated, and the numbers appear to be lower for certain subpopulations, specifically individuals who are younger. The problem is that COVID-19 is scary and continues to frighten us with even more sinister details. As of this afternoon, COVID-19 has killed over 600,000 Americans, and it's not going to stop on its own. Indeed, the new Delta variant, which CDC clarifies as a variant of concern, is everywhere. The most recent data from the Centers for Disease Control suggests that 57.6% of all cases in the United States involve the Delta variant. That used to be somewhat more regionalized, but the problem is that the Delta variant is really growing in the Southeast and has increased markedly up to 48% of all cases now in our region. This variant is more transmissible, meaning that more people who are unvaccinated are going to get infected. And indeed, as Commissioner Lisa Piercy from the Tennessee Department of Health recently noted, you have two choices now. You can get vaccinated or you can get COVID-19. As we think about COVID-19 vaccinations, it's important to note that the information today suggests that the COVID-19 vaccines we have are very effective against the Delta variant and others. Are there breakthrough infections? Yes, but they're rare. And when someone does have a breakthrough infection, it appears that they are very protected against hospitalizations and the risk of death. So thank you for talking with folks about the importance of vaccination. And I do want to stress, if anybody is willing to get vaccinated, it doesn't matter. We'll break a vial. There is not a shortage of COVID-19 vaccine. And if someone shows up 2 minutes before we close asking whether they can get vaccinated, the answer is going to be yes. That's why Neighborhood Health has put over 6,000 total shots in arms to prevent this awful, awful virus. Who should get vaccinated? Any adult who wants to. And now that extends even to children. But for today, we're going to focus on adults. This includes pregnant women, people with any number of health conditions, including diabetes, hypertension, liver disease, kidney disease. It includes people who take lots of medications, and it includes healthy people too. I also want to note that people who should get vaccinated include employees of your organization as well. Can the vaccines give you COVID-19? Absolutely not. You simply cannot get COVID-19 from the vaccines. You just can't. When it comes to other concerns, we often hear questions about, do people's medications make it risky? My father is on 14 medications and 9 different supplements, and I was quick to get him as vaccinated as soon as we could. Medicines don't interfere there are no contraindications. So if you take a lot of medications, continue to take them as your doctor or healthcare provider prescribed them and get vaccinated. But there's no need to take painkillers for side effects you may not need. So continue to take the medications that are prescribed and get vaccinated. Is the vaccine free? You bet. It is absolutely, completely, and everywhere free. And it's free even if people don't have health insurance. Now, the problem is that people don't have this information or that they're waiting. But none of the 600,000 Americans that we've already lost would wait if they were given the chance to get vaccinated and get their lives back. Sadly, that's an option they don't have, but it is an option that you and the people that we serve together do have. We need to make sure they get vaccinated and they don't get COVID-19. Why do people get the shot? At this point, most individuals are going to get the shot to respond to an internal, maybe even psychological need. It might be easing concern by a son or a daughter about a parent's health. It might be so that they can be back in church feeling more confident about being around others. Or as my neighbor did, she wanted to be back at Hadley Park to play bridge again. Many people say they just want to be able to see their unvaccinated grandchildren and not pose a threat. Whatever it is that people choose to get vaccinated, we want to encourage that, meet them where they are, and help them understand how important this is in this moment with a more transmissible variant to get vaccinated. And so again, who should get vaccinated? Any adult who wants to. Pregnant women, people with any number of health conditions, including those who take a lot of prescription medications. Healthy people should get vaccinated, and employees of your organization really should. A quick note about employees of organizations. Right now at Neighborhood Health, almost 4 out of 5 employees are vaccinated, and we're working to make that number even higher. Some employers, like Vanderbilt University Medical Center and Vander University's main campuses, are even requiring their thousands of employees to get vaccinated. So please do encourage your employees to protect themselves and their families by getting vaccinated too. Vaccination has never been easier. You can get vaccinated at any of our neighborhood health locations. In fact, you can do so every weekday. We also offer walk-up appointments. You don't even need to call us to tell us you're coming at 3 of our locations: Inglewood, Welshwood in South Nashville, and our downtown clinic for persons experiencing homelessness. The Metro Public Health Department also offers COVID-19 vaccination out on Murfreesboro Pike at the old Kmart location there during weekdays. And of course, our partners at Walmart, Kroger, Publix, Walgreens, CVS, and any number of other retail pharmacies are offering the COVID-19 vaccination. All of us are offering it for free. If you need a ride, we've got an answer. Just give us a call at Neighborhood Health at 615-227-3000, and we'll make sure that you can get a free ride to your free vaccination. Likewise, Metro Public Health offers free rides to their free vaccinations. Just call 615-862-7777. And many other locations such as Walmart, Kroger, and others are available right on public bus lines. If you have any questions at all about COVID-19, testing, vaccinations, or more generally, how neighborhood health can support you, your organization, and the individuals that all of us are serving, please reach out to me directly. You can email me at bhaile, that's B-H-A-I-L-E, at neighborhoodhealthtn.org. Or if you'd like to make an appointment for you or someone you know or love to get vaccinated, just give us a call at 615-227-3000. And again, we offer walk-up, drive-up vaccinations without appointments as well. Thanks for your time today. Thanks for everything that you're doing to help keep Nashville safe. Please take care of yourself and be in touch if there's anything we at Neighborhood Health can do to support you and your organization.
Great. So that was a great informational video that I hope that even there's a lot of good information in there, and we can circulate this video following the event with everyone, all the attendees, and we'll put it out on our website and other channels. So I guess if you have a question at any point during the panel conversation, maybe you can put it in the chat down here. There's a little chat box with a little speech bubble down there, and you can put your questions in there, or at the end, if we have time, maybe we can unmute and you can ask your question in person. So whichever you feel comfortable, I think that would be a good way to ask questions, and we'll do our best to answer. So at this point, I want to throw it over to Paige and ask her a little bit about the work that MDHA has done to get people, and maybe tell us some stories about how people have gotten vaccinated, or some of the work that's been going on from MDHA's side.
Sure. So I'll let John kind of touch on the client piece and the importance there. Just to give y'all kind of a general overview of what we've been doing this year. So I believe it was the end of January, early February. We were working with the neighborhood health a lot on a daily basis, and the social services coordinators across the properties to get our seniors connected to the vaccine. Neighborhood health made this process so efficient and really easy, to get people in. They saw anyone, they were super flexible, just a fantastic way to get the whole initiative started. One thing that we noticed were that many of our residents did not have transportation, or they didn't feel comfortable driving, or they just didn't feel comfortable taking public transportation because it was the middle of a pandemic. So definitely, understand all those barriers. We were able to work with WeGo, who's been doing a lot of work just in Nashville in general with vaccine transportation. And once we, connected with the resident, knew that they wanted it, got them set up with an appointment at Neighborhood Health, we then coordinated with WeGo to get them to that appointment. So, that was nice. I could just kind of act as a liaison between all those different partners and let the resident know when they would, when WeGo would be there to pick them up. So I think, the resident then had their social services coordinator who could also handle any other questions. I think that really just kind of helped them feel more comfortable with the process, and it made it easier for the resident, knowing that that ride was getting set up for them. They didn't have to call anyone. They just had to show up and be there and be ready to be picked up. So that, especially, at some of these towers that aren't located super centrally to certain clinics, that was just super convenient and really helped many of our residents get the vaccine and encourage people, who were kind of on the fence about it to just go ahead and get that done. So that was fantastic. And then once things sort of really started getting rolling and the vaccine became more readily available and was really open up to anyone who wanted it, we worked with a variety of partners to provide clinics on site. So we did those at the towers and then also extended those to our family properties. We worked with St. Thomas Ascension, Meharry, Metro Nashville Health Department, and also the Vanderbilt School of Nursing. So between all those partners, we've been able to service the majority of our properties. At many of them, we've been there multiple times. And most recently, we've been working with Vanderbilt to do door-to-door outreach. So, one thing that we saw was at this point, just showing up and, letting people know that we're there isn't really enough to get people to come. We would do different incentives, like, we had the Nashville Diaper Connection come and hand out diapers. We had food donated by the Nashville Food Project. So, fresh, nutritious meals. We had food boxes from Second Harvest. So those were all great things to have, and other resources that were really great for people. But, you either want the vaccine or you don't. Those aren't necessarily going to seal the deal for you. Sometimes they do. So, we really found that kind of having someone who's educated on the vaccine and comfortable talking to people, really having them go do that kind of door-to-door walk up is extremely helpful. And we've had great success with that. And we're planning to continue that in the fall. We did get a grant to get 4 community healthcare workers. So I'm really excited about that and just seeing the impact that that has, with the residents. And at this point, even if we get just a handful of people to get the vaccine, anyone that gets it is a win. So we're headed in a really great direction at the agency, and are really, making sure that the vaccine is available to our residents. And, if people have questions, making sure that they know of all the resources that are out there. And, we couldn't do it without all the staff at the agency, the coordinators, other residents that tell their friends and family. One thing at Cumberland View, which is a family property, Cumberland View Apartments, it's in North Nashville. There were a lot of refugees family there. And one woman came to the first clinic by herself. And, I think she brought her kids. And then when she came back for the second dose, she brought like all her friends. They all got the vaccine. They brought their kids, and that was just awesome to see. She told them, she advertised to them, she could speak to them in their native language and let them know, why it was so important to get vaccinated. And then it was right there where they live in their property, and she could bring all of them. So just seeing that really, is fantastic. And I'm excited that we can continue to do this type of work. So.
Yeah, that's great to hear. And I mean, it's amazing the collaboration and all the partners involved and how, I mean, it's been kind of, there's a lot of ups and downs with this whole pandemic, but I think that bringing people together around kind of these big issues has been a common theme amongst probably all sectors, really. And I just very much appreciate all the work that you all put in to try to get all these really important partners together and work together. Like, and in our case, we go in the infrastructure work group. I think those are really great to hear about those types of things. So I guess at this point, John, I want to turn it over to you and hear about maybe some more specific instances that you might have around getting people vaccinated and stories like that.
Okay. I think the challenge, and I want to say that Paige did a wonderful job in coordinating our community health professionals, our transportation, and having it all available for our residents to take a part of this. The main challenge I felt was to build trust, because after all the news had seen, all the deaths that were occurring, their friends, and of course the deaths of their friends getting sick, and the quarantining that were happening in the community was raising many large questions within the populations that I work with. Because in the past, there were experiences like the Tuskegee experiment, and that discussion remains very important within the community that I work in. So it took a lot of work that I needed to do with people that had spheres of influence. For instance, if I could talk to one person that had many friends, then that influence would go to other folks. But I had to do a lot of sit down, going to folks' homes and sitting there and just having conversations with them about what the vaccine was about, that it wouldn't give them the vaccine, that it would protect them. And the challenge remained with the untrust in general of the community that I work with a larger community. So I had to really push that effort. What helped a lot was the way the vaccine was administered, starting with older age groups, and those folks, they came down to take the transportation to get the vaccine, and the community was watching. That the folks that got the older residents that got their shots first didn't get sick, didn't die, and they were able to transfer their experience to the other younger groups. And as that progressed along, we were able to get more and more people to take part in it. Just because we would give out the information, that didn't mean that they would trust it. So they had to learn to trust it on their own. As the ages, of course, dropped, we were able to get more experience and more people took a part in it. But the biggest challenge was to build their trust and to be able to take the time to explain to the residents that this was safe and that they could trust it. It also helped that, of course, the community knows me, so I was able to continue to, with their trust in me, they were able to understand that they could take this opportunity. And so once it got whole, we were able to get, I felt like a herd immunity within our high rises, because what happens with that community also is that most of the traveling that they do outside would be to get commodities that they need to get about maybe once or twice a month. But many of them stay right around those communities. So it was very important that we got a herd immunity. So I believe what we got, somewhere around 65% of our residents vaccinated. And once we got going with it, the trust became easier and easier. Now we still have several within the community that haven't gotten the vaccines, and that challenge remains. And I'm still having people that I'm talking with one-on-one about it, and I still have several that just won't trust it or won't change. So that's not that different from the population of the United States for those that haven't gotten the vaccines. But we were able to get, I felt, a pretty high amount. And then what we did was we were able to communicate with St. Thomas, who committed to bring their mobile unit out to our residents. They came out to Parthenon Towers and, of course, other towers and other communities. And once we were able to get that established, it was much easier for them to come and get their vaccines. And the group of people that were there administering the vaccines, they were very professional, very personal, and they were able to answer their questions and also administer the vaccines. So I believe that the main challenge that we had was the trust that we had to build and we had to continue. We didn't have any, we had possibly 2 or 3 people that got sick, and we were able to work through that, and that didn't panic the community, which was comforting, because that could have influenced many more people not to get the vaccine. But it was mainly the trust. And in the past, we have done other vaccines in terms of the flu shot. And this was much more successful even than the flu shot. So it mainly, I would say, the understanding that our resident got was trust, but having an infrastructure in place to where we could get them to the places, have the providers to come in and administer the shots in an efficient manner. That was very important for us.
Yeah, that's really those are I think you hit it nail on the head, and especially I think was getting at you like with the mobile unit. That's like a lot of things that like what Paige was talking about, like actually going to where people need it and giving people access to the vaccine. And then I mean I think you nailed it, John, like the building the trust. I think the work that you've been doing is super important, and just getting people to trust it and you know, like you were saying, starting with the older folks and building trust in the community that way has been so important. So again, I'm so impressed with the work that you all are doing, and I think we got to keep it up. And so we are running towards the end of our allotted time here, and so I guess any kind of closing thoughts from Paige or John that you want to leave us with.
Well, I'd like to say that it's very important that we don't assume that just because these vaccines are available, that our residents would just jump right on it. So we have to build their trust. I think that's the bottom line, and because we did what we said we were going to do, that we set the schedules up, we followed through on the schedules, and everyone was very professional. In other words, kind toward the residents as they got the shot. That was all very important.
Yeah, absolutely. And we do have a question here coming through in the chat. From your experiences, Paige and John, what are strategies that government, nonprofits, and organizations can help to build trust in communities? What strategies, maybe suggestions or ideas you can offer?
That's a great question. I'll be interested to hear what John says, but just kind of from my perspective, you know, being at these events and the one at Cumberland View with Vanderbilt, you know, we had people come in, even an employee at MDHA that was kind of on the fence about it, wasn't sure. And then once they got there, and everyone was just so friendly, everybody was in a, you know, a genuinely happy mood. It was a nice, I don't know, the feeling was just, you know, being in your community again after being in lockdown for all this time, and people just were happy to be out. We had music, we had popsicles and water. And I think that even that little kind of touch, I think, you know, helped people feel more comfortable, and they could sit down with this nurse who, you know, is giving you the shot. They got it too. Like, I think that had an impact, you know, for kind of some of these people that were on the fence to really feel more comfortable. And then I think just showing up, like John said, you know, we're like with the flu vaccine, we're there once, and then we're not going to be back again until next year. But with, you know, like at Parthenon, which is one of John's towers, like we were there 3 times. So people could feel more comfortable with it. they trust John. They saw him there organizing it. So I think just all of those, have a big impact. But I'll be interested to hear what John says about that as well.
I want to add, in the past, we continue to have conversations about medical issues, about various diseases that are within our community. But we've had forums over the years in just discussing issues like diabetes, flu, or different situations that affect their health in general. So that teaching and that opportunity for several years back, it keeps the conversation open. And I think what's very important is that we keep the conversation open about what can happen to your health and what you need to do to keep your health in a way that gives you the success in your life, and to also have the folks to understand that they are very important in our community, and this is being provided for because of their importance in the community, and we invested in them, and I think that's what they felt. But the continued conversation over years about health issues did help us.
Yeah, absolutely. I think, and we, looks like we have another question in the chat, so I'm going to throw this out to you all. As the COVID-19 variant runs its course, what can Nashville residents do to support your organizations in the fight against COVID? So speaking towards the Delta variant explosion or outbreak, I guess.
Well, I'll let you go on your pages, all right? I think what's important is that there could be a continued investment in understanding of health issues within our community, that we would have more resources. In the past, I've worked with Vanderbilt School of Nursing. I worked with Tennessee State School of Nursing, where we brought them out to the community, have them to teach classes, and to disseminate information about just something very as simple as many of our residents will call diabetes a problem with sugar. Now that we had to reverse that understanding. We had to get them to understand what the A1C, what does A1C mean, to be able to ask questions about what does metformin do, to get more specific in the understanding. And we always need support in that with our community. We can't assume to let their understandings be something that is not accurate. And I think that's very important. Education in the community about our health, and anything that any nonprofit can do to aid that would be very important for our community.
Yeah, no, I was going to say that too, just continued support. Obviously this isn't going anywhere anytime soon. And just, that our partners have been, we've been so lucky, and just Nashville has really come together for this. And it's just been amazing, the amount of support. But I think just, to keep that up and keep reaching our residents and making that resource available. So.
Excellent. Well, I think we're a little bit over our allotted schedule, but I'll put my email in the chat I think I did wrong group there, but I'll put my email in the chat if you're on the call here, and you can email me at eric@civicdesigncenter.org, and then I can distribute or connect you with Paige or John or others, even if it's someone at Neighborhood Health or things like that. So yeah, I really appreciate everyone joining us on the call today, and yeah, we will distribute this this information as soon as we get it uploaded on our website, and yeah, we'll hopefully hear from you soon. So thanks everyone for joining us, and great talking with you, Paige and John.
Thank you for having us.
Thank you. Yeah.
Bye.
Thank you. Glad to meet you.